Hi everyone, Dr. Zuliani here coming live from Bloomfield Hills, Michigan. Today we're going to have a little Instagram and Facebook Live. We're going to be talking about face and neck lifting 101. I'm going to go over the different types of facelifts, neck lifts, who's a candidate, who isn't a candidate. We'll be giving examples of pictures, talking about downtime, talking about motivations behind it all. So thanks everyone for joining us. So what causes facial aging? So it's a wide variety of things. Mainly it's genetics. People will come into my office and consult and say, I'm starting to look like my mom. Not that that's a bad thing, but at ages between 45 and 65, we start to notice that things are starting to sag a little bit. In addition to that, ethnicity and gender play a role. People who have thinner skin, people who are fairer skin, will notice that they have many more superficial lines and creases than people who are darker skin that tend to have thicker and oilier skin. Also, the amount of sun exposure that you're exposed to will also determine how fast you age, as well as certain lifestyle things such as heavy drinking or smoking. So what are we trying to accomplish when we're doing aging face surgery, basically facelifting and neck lifting? The dictum is that we start off looking like an upside down egg and very volumized as a grape is, and as we age everything turns upside down and the heaviness occurs down in the lower 2/3 of the face. We start to have relaxation of muscles, accumulation of fat, and specifically in people who are fairer skin, you start to see a shrinkage of the deep fat planes of the face, and then it's akin to almost like starting as a grape and turning into a raisin. So there's a large variety of things available in adjunctive treatments with facelifting that we may recommend, such as fat injections or even filler injections, as well as laser resurfacing, which may be important for people who have very fine lines or even deepened lines in and around the face. So the 4 R's of facial rejuvenation, what are these? These are redraping, these are face surgical maneuvers, facelifting, brow lifting. We can relax things, deep grooved lines, specifically lines that are there when you're animating, are best taken care of with neuromodulators such as Dysport or Botox. There's resurfacing that's available to us as well, using a wide variety of lasers and a wide variety of depths, as well as chemical peels, to try and smooth out the icing on the cake. And then we can refill, whether that be with filler or fat. All these can be used in adjunctive treatments with surgical facelifting. So what exactly is a facelift? So you'll go online and there'll be a wide variety of things that people talk about. Some people will call it there's a deep neck lift, or a deep plane facelift, or a SMAS facelift, an extended deep plane facelift, or SMAS and recreation, or a mini lift, an S lift, a weekend lift, a lightning lift. It all means a little bit something different to different people. In reality, it is what kind of approach are you taking to take care of the signs and symptoms that you're seeing for facial aging. Now, not everybody needs a deep neck lift, nor does everybody need a deep plane facelift, and it's very dependent on how old you are and what you're coming to me for as your complaints. So, we'll get into sort of the different technicalities and the terms, and hopefully we can elucidate them a little bit. A lot of people will get neck lifting confused with facelifting, and it sort of depends on how old you are, like I mentioned before, and how much laxity you have. Really, the rule is as more laxity occurs in the neck and as you get older, the facelift incisions, which we'll show, will have to be extended to some degree. And that allows us to correct the loose skin, but the incisions really allow us to manipulate the deep layers of the face, whether that be the SMAS, which is the amplifier of muscular movements in the face, or underneath the SMAS or underneath the platysma muscle. The platysmal muscle is the muscle that creates the bands in the neck. And that's when you go deep to those layers, if there's a layer of fat underneath there, if there's herniated glands, if there's problems in terms of the deeper muscles, or where the sort of layering sits determines what needs to be done. So what can a facelift not do? In my office, a facelift doesn't treat the eyelids or brows. So when people say, oh, I want a full facelift, a full facelift means treating everything from here to here. It doesn't mean treating the eyelids, the lower lids, the brows. That can be done through a wide variety of techniques, through an upper blepharoplasty, lower blepharoplasty, or brow lift, and depending on the problems that present, there's a wide variety of brow lifting, which we're not going to get into today. It doesn't remove fine lines in and around the mouth. Anything basically from here in, facelifting doesn't really take care of. And a facelift does not restore volume. It can reposition the volume that has dropped, but it really doesn't plump up anything, and we'll go into that just a little bit. So we'll see people, I'll see 36-year-olds or 38-year-olds who come to me where really they need a facelift, and usually it's from genetic factors, having weaker skeletal structures, having a weak chin, not having very strong cheekbones or very strong jawbones. It's called a gonial angle. Those types of patients present with more of a flatter mid-face, and things start to sag a little bit sooner because they don't have that underlying strong skeletal structure. So performing a face or neck lifting and adjunctive treatments with sort of fat injection in patients who are 34 or 36 isn't unheard of. But most patients present from the age range of 48 to 55 seeking some sort of surgical maneuver to help them accomplish their cosmetic goals. When do people present? Usually it presents when they come along and the kids are sort of out of the house, or they're in high school and college and they're moving, and a new phase of life is sort of developing. And it's an opportunity for somebody to do something for oneself. The motivations behind it are highly psychological in nature. Doing it earlier rather than later adds to the longevity, because as we continue to age and have solar exposure, the skin continues to sag and just doesn't snap back as well as you get into your 60s or even your 70s, which means that the surgery can still be done, but the longevity of it is lessened, and the need for adjunctive treatments to try and stiffen the skin are more necessary later on. So as I said previously, the motivations are highly psychological. It's for people to look their best. It occurs along with getting veneers or having cosmetic dentistry or LASIK. It's an attempt to continue to do things for oneself. A lot of patients will come in who are in the sales force that want to keep up, quote unquote, with the Joneses, with the younger people entering the workforce, and feel it's necessary that they put out a outward appearance that reflects their inward appearance. So when they look in the mirror, they don't feel that old or out of the game. However, when they look, they see reminders of themselves aging. And it's as I mentioned here, it's surprising that early retirement is offered to people at the age 55, where we're seeing people work late into their 60s these days, specifically in the sales force. So how young will I look? I get this a lot. How young will I look? How long will it last? Basically, I say, as a conservative measure, take a look at yourself 10 years ago, 15 years ago, depending on what's going to be done, and that's a good idea of what you're going to look like. Now, you're still going to be, if you're on that escalator of aging, if I bring it back 10 or 15 steps, that escalator is still moving up. I can't stop aging. We can do adjunctive treatments after surgical procedure to help reinforce and stave off that aging, but a lot of it has to do with post-care, avoiding the sun, being well hydrated, and doing small little things in the office to add to the overall result. So what is a youthful neck? Usually people say, I want Angelina Jolie's jawline. It's exceptionally strong. She has very good cheekbones, very strong chin, and very strong jaw. And so all these things lead to a very desirable look. What women usually want is they want a crisp jawline, men too, and a nice, what's called hyomental distance. So this area isn't blunted, it's actually coming up and having a nice defined jawline. Seeing the borders of this muscle here, the sternocleidomastoid muscle, are desirable. Having a little depression underneath the hyoid, underneath here, is desirable. So we all know what a great jawline is. We can see it and just show it. But you know, it's also comes the fact that if you never really had a great jawline when you're younger, in your 20s or your 30s, it's going to be a good conversation that we have that I can't really create that jawline if you never had to begin with. There's a lot of reasons why you never had it to begin with. Most of them being, as I previously mentioned, that the skeletal structure underneath just isn't as strong. So if I recommend a chin implant or different other ancillary procedures, don't be surprised, because that's trying to get at the underlying structures to support the face and to have a sort of a cantilevered approach where the skin can be pulled back against a strong underlying structure. So everybody wants to know, am I going to scar? The answer is yes, everybody scars. If you put an incision on somebody, the physiologic response of the body is called a scar. It's our job as plastic surgeons to make the scar not visible. And we do that by hiding it in certain areas. The way in which we do it here is that we use a temporal incision hidden in the hairline. It comes down to what's called the root of the helix in a retrotragal fashion. This is the tragus. Comes down around here, around the lobule of the ear, back into the crease and into the hairline, or into the hair itself, to try and hide the incisions as best as possible. Certain people are prone to poor incisions, and we would have that discussion, or prone to bad scarring. Most people are not. However, if it does happen, there are things we can do about it. The surgery is done a wide variety of ways. We can do it under local anesthesia, depending on your willingness and ability to stay still, as well as doing it under general anesthesia as well in the hospital. People who have multiple medical problems or medical issues or bleeding issues always have to be done in the hospital. Of course, safety is first. Anybody over the age of 50, I'm going to require a surgical medical clearance. So, this is an elective procedure. It doesn't need to be done, but we do need to know if there's any surprises that we have to prepare for. So this is somebody who I'm showing this 2 months post facelift. It's very hard to see the incisions if they're placed correctly and it's done meticulously. And that's my job to do that. And we rarely have any issues with incisions being shown. Initially they're a little bit red, and that's just how everything heals. Your body is sending cells there and blood there to try and heal that wound. But keeping yourself out of the sunlight for at least 4 to 6 weeks, keeping yourself active but not working out for about 4 weeks or so is really advocated to help this healing period condense. So there's different types of facelifts. When the facelift was originally documented back 1800s, early 1900s, it was more of a pulling the skin and suturing it down. That led to wide scars and a lack of very long surgical result. It wasn't until about the early 70s, mid 70s, when the SMAS layer was really described in a landmark paper, that we understood that the tissue under the skin, which is called the SMAS, can be manipulated in a way in which to cause less tension on our wounds, as well as more lifting capability. And then as time went on, a variety of authors and surgeons began to explore more aggressive type facelifts in manipulating the SMAS, which has led us to this point in time where an extended or deep plane or sub-SMAS approach has really been shown to have the most longevity and the greatest results, because we're going underneath that layer and releasing the ligaments which hold the face in place. So it's only by releasing those ligaments that we can really reposition the tissues and the deeper fat pads in the face to where they once were. So is the facelift the same as a neck lift? Yes and no. A facelift, depending on where the incisions occur and the different types of techniques, can cause the neck to look better. However, it can be a fact where younger people will come to me, and if they have a pathological layer of fat above the muscle, below the muscle, or glandular tissue that needs to be removed, a small chin, where we can do a neck lift without having to do a facelift. So we can do a single incision neck lift in the office, depending on patient comfort and their ability, again, to sit still and tolerate it, without having to excise any skin. We rely on perhaps a machine that I have called a Rejuvenation, which is using the lightning lift, or if the patient's young enough, the skin will just sort of suction back into place if we are allowed to open the tissue enough. And so we've done that in the office here. These are all in-office procedures. People who come to me at a young age where they have, a small chin, double chin, and just doing liposuction on this patient will not work. The liposuction is just the fat. If you make a muscle like this and you pinch that, this is the only fat that liposuction attacks. Kybella as well. So that is all, and it's only limited to certain areas. To get a really sharper jawline in patients such as this, you have to go underneath the muscle, manipulate the muscle in a way, and remove that fat and levels of what's called fascia in the neck to help that neck spring up. Again, same sort of thing, done in the office, takes about 2 hours. Liposuction combined with the chin implant combined with a neck lift. Again, men can do this as well. So the chin to extend the skin and make it stronger, and then manipulating the undersurface of the tissues for fat and fascia. So that combined with these innovations in skin tightening have led us to be able to use these smaller incision type procedures on a wider variety of patients, because we can get the skin to contract even in patients who are a little bit older, whether that's using radiofrequency, ultrasound, or laser. One or all three may be recommended at some point to you. Which has led me to develop sort of a hybrid facelift, which is available in the office and local, using plasma energy along with traditional facelifting techniques to give a result that can be nearly as good as one that's available in the operating room. It's not meant for people who have really, really heavy necks or really, really saggy skin, or who have been operated on before. Unfortunately, those types of patients really would benefit from what's called a secondary lift. Lightning lift is usually meant for people who've never had any liposuction, any energy treatments really to the face. There's sort of what we call a virgin face, and we can use these combinations of procedures to, in the office, give very good long-lasting results without having to have the downtime of a traditional facelift. Now, I call it lightning lift because what we use is radiofrequency that's placed in through a helium carrier, which creates this fourth type of matter called plasma, and lightning is a type of plasma. The science behind it is it shrinks what's called the fibroseptal network. If you were to take a look and you open up and you take a look, and when I'm doing surgery, you see these little connections from the undersurface to the skin. This radiofrequency helps contract and make those holes smaller. So that's the theory behind it. It does work, and a lot of people are candidates and don't need to have a deep plane facelift. So this is me using it in the office. It's done through a cannula or catheter type based system, very similar to a liposuction. It's done almost in common. It's done in common with liposuction. This heats the skin up to a very high degree, and it causes a lot of contraction in the wound. This is us doing it. It almost looks like E.T. phoning home. It's a little bit of a purple light or red light underneath the skin, and uses helium to cool it so the skin doesn't burn. So this is just somebody who we did the cool atmospheric plasma on, just showing a decrease in the horizontal rhytids and overall tightening of the neck and into the jowls. There's no other procedures were performed. This is somebody who we did a platysmoplasty on, where we tighten the bands in here, and then use this to tighten the skin without having to make any incisions anywhere else. Now, does it take care of the jowls? No, not with this specific procedure where I did just a single incision. To do that, I have to make separate incisions around the ear to allow me to pull that up, and that's what I did on this patient, where we had small incision here and small incisions in and around the ear, where we used traditional facelifting type mechanisms, as well as using this energy-based device to cause her to have a lot of tightening in the neck. So this patient was 7 years old. She was 10 years after the short scar facelift, platysmoplasty, and the added benefit of the Renuvia. So right now we're going to go over just some pictures of patients who have had these wide variety of procedures that I've performed, and we'll open it up to questions after I'm done running through this. So this is somebody who had, again, liposuction in the office, under local, wide awake, then had a deeper neck lift where I removed fat glandular tissue and tightened the platysma up. This was only one incision under here with two small nicks behind the ear to cause that amount of improvement. So that's a very good result there. This is a deep plane facelift, neck lift, liposuction, platysmoplasty, and fat transfer. So this is somebody who had a lot of weight loss. So we know that skin isn't going to spring back. So she's more candidate for a stronger type maneuvers, which really lift the skin, really lift the sagging tissues and muscles underneath to create a sharper jawline. You can see that here. It repositions the malar fat pad. We can see this moves up. On side profile, a very nice angle of the mandible, much better than this blunted, and you can see why that is from. This is all loose skin and loose muscle there that has resulted from many years of weight gain, and she went many years of weight loss, I think losing over 80 to 100 pounds. And so to relieve that skin in the face, we've done this type of procedure. Patients are also candidates for body surgery after massive weight loss too. So deep plane facelift, neck lift, liposuction, brow lift. So this is combining a whole bunch of things for pan facial rejuvenation. This is somebody who's about 5 months out right now, where we stabilize the brow through a brow lift technique, trimmed excess fat and skin from the eyes. Excess fat was taken from underneath the eyes, and then doing a deep neck lift, liposuction, and deep plane facelift to stabilize everything. And so we can see that happening here. The deep plane facelift is also the only type of facelift which really helps to efface these folds. You have to go underneath the SMAS to help with the nasolabial folds. A deep plane facelift, neck lift, liposuction, again, jowling, downturned mouth, platysmal banding, lifting that up, causing there to be tightness underneath there. There's a little bit of a muscle underneath here called the digastric on her, which we needed to tie together, and then in the front, having it look smoother. Again, deep plane facelift, neck lift, liposuction. This patient also had a rhinoplasty. It's an exceptionally long procedure. I won't do this anymore. It takes too long. It's 10-hour surgery. But she was from out of town. We did a rhinoplasty to help elevate her nose and nasal tip, and then did a deep plane facelift to really move the cheeks up and define the jawline here. So that's it. And then deep plane facelift, neck lift, liposuction. This patient, one of my early patients early on in my career, where we helped reposition the fat, decrease the nasolabial folds, cause there to be a nice tightening in the skin, and a reduction of the jowls. was her result. So I'm, hopefully it wasn't too much of a whirlwind sort of exposure to facelift and neck lifting. There's a wide variety of things that can be done in the office surgically. There's also lots of things that can be done non-surgically. However, what to bear in mind is the non-surgical treatments, without doing a lot of excisional surgery, only will give you about a 30 to 40% result of a true face and neck lift. But there are patients who want that as well. So at this time, we'll open it up to anybody who has questions on Instagram or Facebook. And if there are none, we'll be sure to look at those and respond appropriately.
I have one. And just remember, guys, too, if you have any questions and you're watching this maybe when we show the replay, any questions that are posted, we'll make sure to go back and answer those. But right now, someone's asking, is the deep plane facelift painful afterwards?
So, good question. So deep plane facelift I can't do in the office, but most people don't say there's a lot of pain involved. There is a decent amount of swelling, and it really does, deep plane facelift is the most aggressive type of lift we do. It takes you out of sort of your life for about 10 days to 14 days. You may have drains in for the first day to 4. The bruising and swelling will cause you to look very puffy for the first 7 to 10 days. The sutures and staples remain in place for about that amount of time, and they come out at different time points as well. The pain is well managed. Most people really don't need any narcotic pain medicine. Most really do need just Tylenol. However, it's uncomfortable. It feels very, very tight, and we're pulling things as sort of as much as necessary, which can cause people to feel like there may be difficulty in chewing. So a lot of patients will have to go to more of a softer diet for a good 3 to 5 days because things just feel that tight. So I would say there's a lot of pain. There's a mild amount of pain though, but nothing that's unbearable. Facial surgery is very different than abdominal surgery or abdominoplasties, where you're really tightening that muscle and you're using your core all the time to stand up. Your face is sort of following the rest of your body, and you can do things to help it relax, sort of not make a lot of facial grimaces, and not eat Big Macs and things like that. So sort of giving your face a rest.
Kind of piggybacking off of that last question, someone asked about post-op complication possibilities, numbness, tightness, anything like that.
Sure, yeah. So tightness is expected and wanted, and that will occur and start to relax over the first, 3 to 6 weeks. At 6 weeks, people start looking excellent after this type of facelift. The biggest complication from facelifting, or the most documented one, is what's called a hematoma. Hematoma is a blood collection underneath the skin, which doesn't necessarily mean anything bad. We do see patients the next day after surgery to make sure blood hasn't accumulated. That's why we'll routinely use drains in patients like this. And those will stay in from 1 to 4 days. If there is one, aspirating small amounts, little amounts of blood, a tablespoon here or there isn't such a large thing. You do have to wear compression dressing after such a surgery. So those are the biggest ones. Numbness expected. That's going to come back over the series of 6 weeks to 6 months. Having some transient ear numbness, some tingling, paresthesias where it feels like electric shocks. You do have to be careful if you use a hair dryer after surgery, because you'll be numb in that region. You can burn yourself if you're not paying attention. Facial problems with the facial nerve, or the nerve that moves your face, are very rare. They can occur transiently, meaning they'll go away. It's usually not from the nerve being cut, but from the nerve being stretched. I've seen it occur over the first 4 to 6 hours after surgery, and then usually just it gets better. Sometimes that's from the anesthetic we use too. But it's very exceptionally rare to have those types of problems. Other types of problems like losing hair along the incisions are rare. Some nausea and vomiting is sometimes expected, just depending on your tolerability to the anesthetic used. However, we only, I only use propofol for my facelifts now, where that's the same type of medicine used for colonoscopy.
Someone's asking, how do you address festoons?
Festoons are not surgically addressed, so those are exceptionally difficult to treat. The only type of festoon you can really surgically remove is what's called a dry festoon. They're separated into dry and wet festoons. They're due to accumulation of fluid in between a lax muscle around the eye. So they're best treated with tightening mechanisms. Sometimes people do lower eyelid lifts for those, but usually trying to address the accumulation of fluid in between the cells, whether that be with laser or radiofrequency microneedling, but they're exceptionally difficult to treat.
How do you decide whether you're going to be doing a deep plane facelift or a SMAS facelift on a patient?
Basically determining how old the patient is and what the presenting problems are. If somebody presents to me with a nice neck, very minimal banding, no fat underneath the muscle here, and just jowling, I don't think a deep plane facelift is necessary. I think it's probably a little bit overkill at that point. I think you can get away with a shorter scar facelift, where the incision sort of stops around here, and using a wide variety of imbrication or plication techniques of the SMAS. Now that's not to say you'll never need a facelift again, and most patients who have one in their early 50s probably have one another 10 to 15 years later. It usually corresponds with your child getting married. So it's not an unknown thing for somebody to have a secondary lift, and that's completely possible too.
So this is a two-parter. Is anyone too old for a facelift? And if a patient has a deep plane in their late 60s, can you expect them to have good results?
Yes, I mean, it depends on what the skin quality is like, actually. If the skin quality is good, it's not too weathered, skeletal, there's good skeletal volume, a good chin, you can expect that to last a little bit longer than somebody who doesn't have that. So being in your 60s, a deep plane facelift is great. It's just what the expectations are after that. Maybe you may need to do some adjunctive treatments more so than you thought earlier, because the skin starts to relax a little bit earlier. And what was the second part?
Is anyone too old for a facelift?
No. I mean, the oldest I think I've done is 81.
Mm-hmm.
It just sort of depends on how healthy you are. If somebody's had, 2 kidney transplants, 3 heart attacks, and a blood clot in their leg,
Bleeding issues.
I'm not going to be operating on you. I mean, there's bigger fish to fry there. So it's all dependent on the patient. But people in good health, they're good candidates.
I think that's, let's see. Where do you put the drains?
Well,
If you use drains.
they're extending basically into the neck, not the face. So you'll see a little tube coming from behind the ear, and you'll see like a little, looks like a big fat pappardelle pasta coming in through here, and another one this way. Sometimes I use one, sometimes I use 2. They come out. If the drainage is low, they'll come out the next day. If it's not, I'll keep them in for a few more days. It does not hurt to remove the drain. It's a little snip of the suture and then pull out.
Someone asked, is there a better time of year to have this procedure?
Well, I really don't want you in the sun afterwards. So in Michigan, people who live up here want to be out in the summer. So 6 weeks after the procedure, I want you really not in the sun at all. Now, in Florida, facelift season is the summer because nobody really goes outside in the summer in Florida. They're staying indoors. So it all depends on where you live and your activity level. But I really don't want a whole lot of sun exposure for 6 weeks. And then activity level too. You're not going to be going out and playing tennis a week later. You're going to have to wait on that.
Yeah. So Thank you. I see some of you are just joining late. If we're going to post the replay, so you can go back and watch it, and feel free to ask any questions you have, and we'll make sure Dr. Zuliani comes back to answer them.
All right, thanks everybody for joining us. Let us know if you have any questions on our social media platforms. We'll be happy to answer those for you.